Dr. Nathan Way, and I'm a board-certified rheumatologist and expert in regenerative medicine, which is the use of stem cells to heal arthritis and restore normal cartilage and connective tissues such as tendons and ligaments and so on and so forth. Today's episode is about what stem cells are and gives a glimpse into what they might be used for. At the time of conception, when the ovum, the egg, is fertilized, a process of cell division begins. And it's at this point of the earliest development of the embryo, the cells that have begun the division process are referred to as early embryonic stem cells. And these cells are unique in that they are what are called totipotent. They are the most plastic, most flexible of all cells. And what this means is that they can be coaxed into becoming any type of tissue without any limitations whatsoever. While these cells are theoretically the most effective in terms of medical use, they are obviously the most difficult to harvest, and there are obviously, again, ethical and religious considerations regarding their use. Once cells have divided more to the point where they are about 100 cells or so, there is differentiation of this mass of cells, and the inner portion is called the embryoblast, and the outer portion is called the trophoblast. And this is called the blastocyst stage. These embryonic cells are what are termed late embryonic stem cells. And they are no longer totipotent since there's been some differentiation that has taken place, some differentiation that has occurred. But they are referred to as pluripotent stem cells. And these cells can still become almost any type of tissue. They still have very high regeneration potential, but perhaps not quite as much as the early embryonic cells that I talked about previously. At the fetal stage, stem cells are referred to as, well, fetal stem cells, and they are multipotent because they are partially differentiated. Their ability to become any type of tissue is slightly limited. However, certain populations of these embryonic stem cells or fetal stem cells are called mesenchymal stem cells. And these are what have drawn a great deal of interest because of their capacity to differentiate into various connective tissues such as bone, cartilage, etc. At a further stage, at the time of birth, stem cells are still found in bone marrow and umbilical cord blood. These retain multipotent properties. Umbilical cord blood-derived stem cells have actually been used for many years in transplantation procedures, and are still used for that matter to help reconstruct a patient's blood after chemotherapy. Adults also have mesenchymal stem cells on board, and these are present in various tissues including fat, bone marrow, the periosteum, which is the surface of bone, as well as other regions. And these adult mesenchymal stem cells are multipotent, and their value is in their ability to be able to regenerate into connective tissue, specifically cartilage and bone. While there have been some concerns about their regenerative capacity, it is now believed and now felt that they are much more plastic than once thought and can be very effective for the treatment of disorders such as osteoarthritis. Well, that about wraps up today's episode. What I'd like you to do now is go to the button below the video and click on it. It says click here, and that'll send you to a page where you can sign up to receive more free videos and more free information. We call this our stem cell portfolio. It's all free, and it's really very, very good stuff. So again, thanks for watching. This is Dr. Nathan Way. See you on the other side.